This is LBC from Global, leading Britain's conversation with Nick Ferrari at breakfast. Call the Cabinet. Ask your question now. Call 0345 6060 973. This is LBC.
Morning, 4 minutes after 9 on Monday, September the 7th, the start of Call the Cabinet, which will be a regular feature. And if you look at how COVID has impacted the government, every single department has been affected. But it's fair to say, notwithstanding the impact, of course, for the Home Secretary and for the Chancellor and for the Prime Minister, one person who's been front and forward from the word go is the Health Secretary, Matt Hancock. So it's a privilege for you, Mr Hancock, to be the first person to appear on Call the Cabinet. I'm very grateful to you.
Thank you for having me.
Thanks for coming along, Mr Hancock. But I have to confront you with some headlines this morning. Fear that Britain is losing control. Daily cases rise to 3,000. Ministers have lost control is another front page. This is as cases go to their highest number since, I believe, May the 22nd.
Yeah.
What is the story out there, and what are you and your colleagues doing about it?
Well, these rise in the number of cases that we've seen in the last few days is concerning, as I said last night when we published the figures. And it's concerning because we've seen a rise in cases in France, in Spain, in some other countries across Europe. And nobody wants to see a second wave here. And it just reinforces the point that people must follow the social distancing rules. They're so important.
Do you sense they're not, Mr. Hancock?
Well, we certainly see cases where they're not. And then we take action. So, for instance, there was in Bolton where the numbers are the highest. We've traced a lot of those cases back to an individual pub and taken action on that pub.
What action do you take against
Well, obviously the pub needed to close, and the problem needed to be sorted out. We've seen the same. So that sort of action, like we've seen a big rise in the number of cases in Norfolk because of a problem at a chicken food factory, and we've taken action. We closed the factory. We've traced all of the workers, got them to self-isolate. So. We are seeing problems of social distancing in some cases. The vast majority of people are still doing the right thing.
Is it age? Is there an age
Yes.
demographic here?
Yes, and this is really important point to get across. The rise in the number of cases we've seen over the last few days is largely amongst younger people.
Define younger.
Under 25s, especially between 17 and 21. And the message to all your younger listeners and to everybody is that even though you're at lower risk of dying from COVID if you're that age, if you're under 25, you can still have really serious symptoms and consequences. And long COVID, where people 6 months on are still ill, is prevalent amongst that population, amongst younger people. Also, you can infect other people, and this argument that we've seen, that some people come out with saying, you don't need to worry about a rise in cases because it's younger people and they don't die. Firstly, they can get very, very ill, and secondly, inevitably it leads to older people catching it from them. So don't infect your grandparents. And in France, for instance, and in Spain, where I mentioned we've seen this rise in cases, they're now much, much higher. In Spain, the number of hospitalizations has gone up by 14 times since the middle of July. In France, the number of people in hospital has trebled over the last month or so. And so the problem is that spreading the disease amongst young people then leads to older people getting it. So young people themselves can get it, and then older people can too.
So do you think, is it the view of you and your colleagues that it's the young people who aren't perhaps washing their hands as diligently as they might, using the hand gel? Those early days where everybody effectively seemed to buckle down, it's perhaps the youngsters who've lost their way.
Well, it is important for everybody to wash your hands, to follow the social distancing. It's hands, face, space, as in wash your hands, cover your face when appropriate, and stay 2 meters apart if you can, or 1 meter plus. And we're going, we will take action if people go to, big social events that are completely inappropriate, sadly, in a time of coronavirus.
Okay. And in some of the newspapers, you have medical professors suggesting this could be a return to exponential growth, further increases over coming weeks. Is there also the argument, of course, Mr. Hancock, as you're doing more tests, you're going to find more cases? Is there any validity to that?
There is a degree of that, but we also check what we call the test positivity. So both the number of cases that we find, and we are doing record amounts of testing, but it's also the proportion of people who test positive. So the test positivity, as it's called in the technical lingo, that is going up as well as the number of people who we're finding. If we just put more tests in and we got more positives in a proportionate way, I would be more relaxed about it.
Have you lost control, as one headline suggests?
No. But the whole country needs to follow the social distancing because, we can only do this as a whole society. It's back, the messages that we all got used to in April, in May, as we were getting to grips with the first peak, when this first came through, they are just as true today, which is that everybody has a role to play in following the social distancing because otherwise it will spread more broadly as it has in some of our closest neighbours.
And lastly on that, one Professor Gabrielle Scally, who you possibly know or know of, an ex-public health director with the NHS, it's no longer small outbreaks, it's endemic in our poorer areas. Is that do you recognise that?
Well, over the summer we had particular problems in some of the areas that are most deprived. Actually, the recent increase that we've seen over the last few days is more broadly spread. And is not concentrated in poorer areas. So it's actually amongst more affluent younger people, especially, that we've seen the rise, and that is where people need to really hear this message and abide by it, which is that everybody has a responsibility for social distancing to keep themselves safe and to keep others safe.
Let's go through some of the calls. A piece of paper if you need to make note of anybody's any points that you want to make. First up is Francis in Twickenham, and you're through to the Health Secretary. Francis, go ahead.
Hello, good morning. I am shielding. Well, I was in the shielding group. I am still shielding because, having seen the numbers, I'm positively terrified. My daughter goes back to school tomorrow, and whilst the school have put lots of things in place, done the very best they can with basically very little information, what happens if there's an outbreak in her school?
And Francis, how old is your daughter?
14.
14. So the good news is that 14-year-olds are unlikely to be seriously affected. And what I was saying just now about younger people is for those a bit older. And the public health advice is really clear, which is that that shielding has been paused because the rates are relatively low, and I'm really, really pleased that we've been able to get schools back. And I think that the fact that schools have gone back,
to the rise, could it not help?
Well, not yet, actually. No, we think because the schools have only gone back in the last few days. So we don't think this is from schools going back. It's from people a bit older than school age.
Well, you said earlier.
Yeah. So the reason that the public health advice is as clear as it is about shielding is because the clinicians and the chief medical officer and his team who advise me are really clear that it is safe for the schools to go back, and that if there is an outbreak at school, then if your daughter is in a bubble within the school with somebody who tests positive, then she will be asked to go home and to self-isolate at home.
Back to Francis, of course.
Well, this is why it's so important to keep the numbers down overall, but the numbers are, especially amongst the school-age population, are really, really low.
Okay. As you said earlier, it's a slightly older group.
It's a slightly older group where we're seeing the rise. So I hope that's reassuring. Our decisions that we've taken on shielding have all been entirely driven by the clinicians, because it's essentially a medical question, Francis, and I understand entirely why you're worried. But that's the reassurance that I've been given from the Chief Medical Officer.
Good luck to you and your daughter, and I hope you know, as I think most do, the importance of getting our children back to their respective schools. Terry in Birmingham, you're through to Secretary of State for Health. Go ahead, Terry.
Good morning, Nick. Hello, Mr. Secretary. I work in medical devices for one of the biggest suppliers of the NHS. Now, with regards to a potential no-deal Brexit, my job could certainly be affected, which as many industries, but also, more importantly, patients' lives could be affected. With regards to our products being manufactured, the majority in Europe, we had a challenging time during the March 2019 deadline to get these in. Now, how can the government say it's a good outcome if we don't have a trade deal? David Frost saying the UK won't blink first, when the waiting list is already nearly 10 million. We had trouble getting products in which could save patients' lives. Do you have that same attitude as well, Mr. Hancock?
Well, the good news, Terry, is that we have a deal already, and so even if we have no further deal, we made an agreement for the actual exit from the EU at the end of January this year, and we have a huge amount of work that's in place to ensure the free flow of things like medical devices. It was, I remember it well. It was much more challenging first time round until we got that deal and were able to ratify it here in the UK Parliament. And so we will be leaving with a deal. The question is whether we get a Canadian-style future arrangement, which obviously we'd prefer, or whether we have to leave on the basis of the deal that we've got on what will essentially be an Australian-style exit. So there's a huge amount of work underway to ensure that the flow of things like medical devices is free-flowing.
We've moved on from Operation Yellowhammer, have we? Because you'll recall it was just a year ago where we found out through Operation Yellowhammer the detrimental impact on the supply of medicines and medical supplies. You can tell me there will be no problems with those medicines.
Well, we've put in a huge amount of work before the original deadline. And then, of course, COVID itself has brought enormous challenges and strains on the supply of medicines and medical devices. You know, remember the work that we did on ventilators, which was ultimately successful. But there's also within medical devices specifically, you know, the European side have put back a change in the rules that they wanted to put in place because of coronavirus. That actually means that we will be. I'm comfortable that we've got in place the plans that we need.
So the supply chain will not be disrupted?
The first and foremost, I very much hope that the Europeans will come to the table and we can agree a deal.
Are you as gung-ho as the Prime Minister, who says if there's no deal in the middle of October, we move on?
Yes. Yeah, we will be able. We absolutely will be able to move on.
And the health of the nation will not be detrimentally impacted by such a robust approach.
That's right, because we already have a deal. The question is whether we can land a long-term future trade agreement, and I'm confident that we can.
So we needn't worry about Yellowhammer.
We're doing all that planning has been done in case it's needed, but I'm much more comfortable than I was before what was then genuine no deal.
We'll get our drugs and we'll get our medical kit. It'll all come through.
I'm comfortable that we've done the work that's needed.
Thanks for that, Terry. Good luck with you and your job. Joan in Ruislip. Joan, you're through to Matt Hancock. Go ahead. Good morning, Joan.
Good morning, Mr. Hancock.
Hello.
Hi. I just wondered if you could explain to me the situation in nursing homes at the moment, where my mother has been locked up for 6 months now, like a prisoner who did not commit a crime. Her crime is getting old and sick. How do you think this is fair, that this is carried on when you've opened pubs, you've opened many other things, but there is no mention of these people in care and nursing homes? Can you tell me how you think this is fair?
Well, I entirely understand your point, Joan, and the challenge to keep people safe in nursing homes has been a very significant one. And we made a change to the rules around visitors and allowing visitors about 6 weeks ago, and gave that the decision making to the local area and to the home themselves. So before that, we had put in place restrictions on visitors, which I was reluctant to do, but it was unfortunately necessary when there was a lot of virus about. Now and then we were able to lift those national restrictions, and so it is it's a decision for the local area and the local home itself. I think so. It's absolutely worth you should engage with them. They will be taking a decision based on what they think is important in terms of the risk locally.
But to Joan's point, there was government advice as regards going to the pub or going to a restaurant or whatever it might be. Shouldn't there be similar advice to care homes?
Well, there was absolutely the same sort of national advice saying that we shouldn't have visitors to care homes, and we've lifted that and said that care homes need to make the decision for themselves on a risk basis.
Her mum's individual care home.
I certainly would,
okay.
and we should. And if there's too many care homes doing this and restricting visitors in a way that is it is the local director of public health who's ultimately responsible for the decision over the visiting policies of the care homes in their area.
Some figures, Joan, thank you, good luck with your mother. Some figures came out, Secretary of State, last week from the Press Association, a poll they did, showing that at least 400 daily deaths involving COVID occurred in care homes at the outbreak's height. Do you recognise that figure?
Well, I haven't seen that specific figure, but of course there's a lot of people who are vulnerable and elderly, and one of the awful things about this virus is that it affects people who are older much more and who are more vulnerable. I mean, it's just really...
Is it right people were discharged from hospital to go into those care homes?
Not without infection control procedures in place. And I know there was a big debate about this, and especially before the science was clear that people could pass on the disease before they had symptoms. But in all cases, that was done on any move like that was done on the basis of clinical advice with the infection control procedures in place.
So it wasn't a situation of just clearing out the hospitals, as it were, and moving those elderly people into others into residential care homes for them to die.
Each individual decision for what one person should do was based on a clinical decision. But
was there a mandate? We need to clear the wards. We need as many beds as we can in our hospitals.
Well, there was absolutely a need to ensure that our hospitals were ready, but there was also rules in place in terms of the infection control procedures, and each individual decision has to be based and was based on clinical advice rather than a rule set by me in Whitehall.
Let's go to other questions. Wendy in Bracknell. Wendy, you're through to Matt Hancock. Go ahead. Good morning to you.
Good morning, Nick. Good morning, Mr. Hancock. I'm a corporate travel agent myself, and my husband works for an airline. After this month, we're both being made redundant. In light of the fact that the travel industry is facing losses of around $1 trillion globally and 100 million jobs, you said that previously airport testing would only reveal about 7% of infected cases. However, with previous illnesses such as SARS and swine flu, airports have had thermal scanners checking everyone that's passing through, and at least gives an opportunity to identify some of the at-risk people. But my question to you is, if you're unable or unwilling to put these measures in place, what is the government doing to protect the travel industry in this country, and what measures are you taking to protect and reassure the travellers?
Yeah, well, Wendy, my heart goes out to you, because the travel industry has been had a terrible time because of coronavirus, and especially you and your husband both work in the travel industry, so I can see the impact it would have, and it's it's one of the many problems that the coronavirus crisis has thrown up. We are working to try to find a way to allow for the quarantine to be reduced, but done in a way that also keeps people safe. And we can see with these increased numbers of cases the importance of making sure we protect the health of the country from especially from areas of the world where there's a very high number of cases, and finding a way to do that safely, that works effectively, that people can and will follow, is really important. Sadly, unfortunately, just doing one test at the border, because it doesn't work, and the reason it doesn't work is because this virus can incubate for a period inside your body without then a test being able to pick it up. So that's why the day one testing doesn't work.
But we have seen other countries use it at their airports, and there is a suggestion today that your colleagues at the Department Department of Transport, reportedly rattled by Conservative anger over the 14-day quarantine policy, are looking at testing 8 days after arrival. I'm sure you've been made aware of this. Do you recognise this?
Well, not just made aware of it, but I'm working with Grant Shapps and the travel industry and others.
So when might this be a reality?
Well, it's one of the things that we'd like to bring in as soon as it's practical to do it. The point is that you mentioned other countries have done this around the world. Unfortunately, all of the countries that brought in testing on day one have then changed that and brought it in at a later point. And so it is something that we're working on, but it isn't something that is as straightforward as simply testing people when they get off a plane, because of the number of people for whom that wouldn't catch. And I think everybody understands how important the quarantine policy is. When we brought it in, there was a lot of noise, a lot of people saying this wasn't necessary. But sadly, if you look at the number of cases in India and Brazil, and now closer to home in Spain and in France, people can see why we've had to bring that policy in.
But as you've just heard from my caller there, there are thousands of jobs going on almost on a daily, on a weekly basis. The airlines have got to get going again, don't they? Doesn't it fall to you and Mr. Shapps to work out a way to do this, Mr. Hancock?
To work out a way to do it safely and that works and that protects people in this country, because we've got to try to keep people safe here, as well as, of course, allowing for travel. And I'm really glad that we did manage to bring in the travel corridors over the summer, and many people were able to get away. But obviously, it's nowhere near where it is in a normal year.
Let's go to Nick in Nottingham. Nick, you're through to Health Secretary. Go ahead. Good morning.
Oh, hi. I'm not happy with the testing system at all. We were promised a world-class test, track and trace system. I was displaying COVID symptoms a couple of weeks ago. I live in the city of Nottingham. I went onto the government website to book a test, and the nearest test centre that could fit me in was 350 miles away in Dundee.
Yes.
Mr. Hancock, 300. No, that can't be the way the system is meant to work.
No, and we've changed that now so that people get offered tests within 75 miles, which is still quite a hike if you need to. But the challenge is that we've got the biggest testing system per head of population in any major country in Europe, significantly bigger than France, Spain, even significantly bigger than Germany. But over the summer, we've seen the demand for tests go up, and so some people are. If your local centre is full, then people were asked to go quite a long way.
Nick, how long ago was this that you were asked to go to Dundee? Tell me when that was.
10 days ago.
10
days ago, yeah.
How can a system ever have been signed off that would allow someone to be suggested they travel 350 miles?
Well, because if the alternative is not getting access to the test,
to go from Nottingham to Dundee.
Well, look, the good news is the vast majority of people get a test, get offered a test.
I don't even know if he's allowed to go to Dundee. Scotland might not let him in.
The vast majority of people get access to a test at their local testing centre, and it's turned around very rapidly. The vast majority of results come within the next day. But there have been problems, Nick, and we're increasing capacity. And I announced last week £500 million of extra money to increase capacity, partly because of exactly the sorts of problems that you're talking about. So it has been there have been operational problems and operational issues. We've been completely upfront about the challenges that the country faces. But all I can do is just keep driving the capacity of that system higher and higher and higher.
And can you put your hand on what I'm sure is your healthy heart and say, as far as you and your colleagues are aware, 75 miles is the absolute maximum anybody has to travel? No one now should be going further than 75 miles.
That's right. That's the system that we've put in place since in the last few days.
Last few days,
yeah.
OK. Nick, I wish you well. Thank you for coming on. Raj in Windsor, you're through to Secretary of State. Go ahead. Good morning, sir.
Hello, Mr. Hancock. I'm a pharmacist, and I've been working throughout the COVID crisis. We've done vitally important work. We've had very little changes in our working times and how we've worked. So we've been offered a very vital service in times when the doctors have been shut, the dentists have been closed, and optometrists have been shut. What additional funding and investment will you be placing for pharmacy as a global sum in view of the fact that you've decimated our funding for the past 10 years? The global sum has been reduced from 3.8 billion to now 3.59 billion. So you've offered emergency funding of 370 million. Will that be clawed back, or will you be offering additional investment for the future in view of the fact that we've offered such a vitally important service throughout the crisis?
And just a bit of background, there was a study, I'm sure you were made aware of this, last week by Ernst & Young that shows that around 70% of some family pharmacies could be going bust within 3 or 4 years.
Yeah, look, Raj, I totally agree with you about the service that pharmacists have delivered. Well, I'll come on to that because it's really important, and we have, as Raj said, put more money in, and I also want to put more services through pharmacists. So it's not just about what, as you call, the global sum, which is a technical term for the amount of the amount we pay pharmacists as a sort of baseline to be there to provide for their local community. It's also that I want to put far, far more health services in pharmacies. So you can go and get tests in pharmacies. For instance, I want people to be able to go and get their flu jab much more easily in pharmacies.
Administered by the pharmacist.
Yes, and pharmacy technicians. So broaden the range of people who are allowed to administer the jab. I want pharmacists to be backed much more to be able to deliver services, but because precisely, yes, and be paid to do that. So just as Raj says, pharmacists are there in the local community. Almost all pharmacists stayed open all the way through, including through lockdown. I remember going to a pharmacy in the middle of lockdown to see how they were doing, and it was in London on a busy, what would normally be a busy London street, and you looked up and down and there was nobody out, and almost all the shops were shuttered except for the pharmacy, and that was repeated on high street after high street across the country. So I'm basically, Raj, I'm completely with you. There has not been a cut to the support for pharmacists since I've been health secretary.
But you do agree there has been prior to your arrival?
Yeah, and then I put a stop to it because I am a massive fan of pharmacists, and I think that pharmacists can do far more and can be they are the front door to the NHS in the community.
So will you be asking Mr. Sunak for more money?
Well, within the NHS budget, I want to drive more money towards pharmacy, and the NHS budget is going up, and I want to do a deal with pharmacies where we offer more NHS services to be delivered in pharmacies, and we pay people for that.
All right, couple of last questions from me. You may be aware Australia expects to receive AstraZeneca's vaccine within months, possibly January, February, New Year.
Yeah.
Around 3.84 million doses. Are we in line behind them? Are we ahead of them?
No, we're ahead of them. We've got 30 million doses already contracted for with AstraZeneca. In fact, they are starting to manufacture those doses already ahead of approval, so that should approval come through, and it's still not certain, but it is looking up, should that approval come through, then we're ready to roll out. And in fact,
this year?
Well, the best case scenario is that happens this year. I think more likely is the earliest part of next year. But in the first few months of next year is the most likely. But we've also bought vaccine ahead of it getting approved from a whole different series of international vaccines as well.
How important is it to get back to your place of work this week, provided you can safely and you can use public transport safely? How important is it for the economy, Mr. Hancock?
Well, absolutely, you should, if that's what your employer wants, and if it's COVID secure. And the vast majority of workplaces are COVID secure, and so that's a discussion that you should have with your employer. But we back people going back to work. It is safe to go back to COVID secure workplaces.
And lastly, your colleague in Cabinet, Oliver Dowden, says that he's pretty certain that he might be able to get the Panto season back. If I was to say to you, Matt Hancock, oh no, you can't, how would you respond? Do you think we're going to have Pantos?
That is the hope we hold out for the nation, that we can get things going, even if there isn't a vaccine, that we can use mass testing so that people can check whether they have the virus today. If they don't, then go and do things even if it means being in close confinement. So the way that I'm working with Oliver and the Prime Minister on this, as Nick said, he talked about the need for more testing. Absolutely right. And we need to use the next generation, next design of tests, which don't require you to send the swab off to the lab and get the result back. But there's a new technology that we're backing, we're putting a lot of money into, to get a test where you can have the turnaround essentially on the spot within 20 minutes, half an hour. And so you could imagine being able to go to something like, whether it's the theatre or to a sports event or to work, and you have the test within maybe under an hour, if we can get it to that. You get the result back. If everybody's negative, then they can go into the theatre.
Cinderella can go to the ball.
That is what we're working on. I'm not saying categorically, but I am saying that is the hope, and that will also, I hope, allow us to have a Merry Christmas this year.
But if you can do that for the London Palladium, why can't you do it for London Heathrow?
Well, it's exactly the same concepts that we're working on.
But if you can allow someone to be tested and then go to the Palladium, why can't you?
So the challenge on Heathrow is that it is this test proposal for the Palladium, as you put it, is to have confidence that somebody is not infectious at that moment for that day. For somebody coming in from Heathrow, we need to know also that they're not incubating it, because you'd essentially, under the mass testing proposal, you'd essentially get a pass to say for the next 24 hours we are confident you are not infectious. You might still be incubating it and get ill a week later. The challenge with people coming in from abroad is that we need to know that they are not going to go out and infect everybody. Now, we may be able to get to the point where you can regularly test every day for 2 weeks, but that requires enormous number of tests, and these tests to be faster, turned around faster, and that means we've got to have the new technologies, which we've been putting money into for months to get the innovation through. Several are now. I'm dealing with about 100 companies on this that have come up with innovative new tests. We've now got to the stage where about half a dozen of them are being rolled out, and so far that's going well. And then we want to be able to use them in this sort of rapid turnaround way. And the holy grail of testing is the pregnancy style test, so that you might get up in the morning, Nick, and you might stick a stick, just have saliva,
like a cotton bud.
Yeah, I want to get it so that at the moment you have to put it down to the back of the throat. Yes. It's pretty unpleasant. I'd like to get it where the saliva, you put the saliva into a pot. Whilst you brush your teeth, you have a shower, you get out the shower, maybe half an hour later.
I don't shower that long. I know I'm a big lad, but I'm not.
Maybe after breakfast. Then
it's a bit rude.
You look at the, the hygiene's important. You look at the results of the swab, and then you'll know that you are not infectious that day. If we can get to that position, then that would obviously transform how we can act as a society short of the vaccine. So both the testing, mass testing, and the vaccine are both essentially, think of them as technologies that can help us to escape from the social distancing that right now is absolutely necessary. And we've been hearing all the negative consequences of social distancing from Joan and from Wendy and from Francis on these calls. And that is what, you can probably hear in my voice, this is what gets me out of bed in the morning, because these are the ways that we get through this, and then we get back to recovery, to economic recovery, and to flourishing as a nation once again.
And all I did was ask him if I could see Goldilocks and the Three Bears, but I'm very grateful. Thank you for taking part in the first call to Cabinet Health Secretary Matt Hancock here on LBC Where News with Simon Conway's next.
The Health Secretary Matt Hancock has told LBC the rise in coronavirus cases in the UK is very concerning. Almost 3,000 new infections were recorded yesterday, the highest number since May. Mr Hancock says the increase is being driven by people aged between 17 and 21.
It's actually amongst more affluent younger people especially, that we've seen the rise, and that is where people need to really hear this message and abide by it, which is that everybody has a responsibility for social distancing to keep themselves safe and to keep others safe.
A man has been arrested over the string of knife attacks in Birmingham, which left one person dead and 7 others injured. The 27-year-old was held at around 4 o'clock this morning at an address in the Selly Oak area of the city. As the government encourages people to return to work, exclusive research by LBC has found only a third of Londoners expect to do so every day of the week. That compares to almost half of workers outside of the capital. And the weather, rain in the northwest, which will be heavy at first, will edge southwards. Fog patches clearing the south and then brighter, feeling warmer in the east, a high of 22 degrees.
Eddie Mayer, Monday to Friday from 4 p.m. LBC.
This is the nation's health. It's your health. Who do you trust on COVID?
Well, trust is a very difficult